Cardiovascular diseases are a leading cause of death worldwide, and at least 2/3 of cardiovascular deaths today occur in low and middle-income countries. Since 2008, First Cardiology Consultants in Lagos has been building a premier practice to address this problem. And today, they're taking their journey to new heights. The group is launching a new foundation, the Healthy Heart Foundation, to bring affordable, inclusive, and accessible cardiovascular interventions to Nigerians. To kickstart this, between the 13th and 25th of September 2021, free open-heart surgeries will be performed on Nigerians in need by a team of local and international surgeons. The first patient to receive a free surgery is a 23-year-old lady with an atrial septal defect, more commonly known as a hole in one's heart. She has requested to remain anonymous.
I found out that I had a hole in the heart March 2021. It was my husband that found out that my heart was beating so fast. Then he asked that we'll go see the doctor. And when we got to the doctor said I had a hole in the heart after the medical checkup and everything, which is also known as ASD. I was referred to the first cardiology consultant 2 weeks ago through the Healthy Heart Foundation. And I'm also happy about this surgery because I know through this surgery, at least I won't be getting tired at every little thing I do.
Non-communicable diseases like cardiovascular diseases are often regarded as silent epidemics. Dr. Imad Tabri is a volunteer doctor with the VOOM Foundation, an international medical humanitarian organization partnering with the Healthy Heart Foundation. And he will be leading the surgeries over the next few days.
Most of these people have congenital disease, like holes in the heart, whether in the upper chamber or lower chamber, and that's a bad disease because it puts a lot of pressure on your heart and becomes short of breath. But some of them also have rheumatic fever, which is an infection that involves the valves. And the valves, instead of moving nicely and smoothly, they become stiff. And not only they become narrow, so they don't let the blood go through, or they got stuck together, away from each other, and they let the blood go back in the direction it's not supposed to. So these are the conditions. And then there are other conditions that are acquired. No one knows why, mostly in women of a middle age, where the mitral valve especially starts leaking. And now we learn to repair these conditions if we can.
Inside the operating room, the team of surgeons are working hard to provide this young patient with a healthy heart. The average open heart surgery usually takes about 4 to 6 hours and costs a bare minimum of about 3 million naira in a public institution and 5 million naira in a private practice. While this is far cheaper than it would be abroad, open heart surgery is generally regarded as one of the most expensive surgeries today.
It's a lot of expenditures, a lot of supplies, tubes, medication, something called cardioplegia to stop the heart, which is very expensive. And the heart-lung machine with its supplies alone is extremely expensive. So in the United States, an open heart surgery does not cost less than $60,000. And very often the hospital charges $100,000, but they don't get reimbursed $100,000 by the insurance company. You get reimbursed much less, but it's very expensive. And the supplies you use, like the valves, each valve you use is between $2,500 and $3,500. It's probably the most expensive of all surgeries, but because the supplies are different, and I'm sure the medical companies are not helping much. But I must correct my statement. All our supplies for this mission were provided by superb companies. All we have to do is ask.
The good news is that since 2004, there's been a significant increase in the number of open heart surgeries performed in Nigeria and how much more accessible it's become. Far more surgeries in the country today are being performed by resident teams rather than visiting teams.
Surgery often starts working with international partners, but the idea is there should be skills transfer. So at some point, the local teams are able to begin to do manual work on their own. So you can see here in Nigeria, it's really the same thing. very low numbers in the early 2000s, but it has gradually increased. In blue is the visiting teams, in green are the resident teams. You can see that in the last few years, there have been fewer visits by visiting teams, and now, especially in last year, which was the middle of COVID, there's still a lot of surgeries being done by the local resident teams. So the message out there is that these institutions are in a position to offer heart surgery, and it is growing across the country.
In total, there are currently 4 cardiothoracic surgeons across Nigeria. But finances and also a lack of awareness are barriers for many people. So the Healthy Heart Foundation hopes to bridge this gap by delivering the highest quality, comprehensive cardiovascular care in the country to people in need from now on a routine basis. Leila Johnson Salami, Arise News, Lagos.